the 5,400 people who call Stark home, medical care will be harder to come by. Shands Stark and Shands Live Oak Medical Center were sold. The new owners, HCA Healthcare, will operate the sites as emergency rooms only. Today, News4Jax reporter Jim Pickett traveled to Stark. He spoke with patients and others who really aren't sure what's going to happen now.
I've been talking to people here at Shan Stark, obviously upset that the hospital is closing. And they believe that people in Bradford County and this entire community are going to lose out and put their lives in danger.
Help! I need somebody. Help! Not just anybody. Help! I need someone. Help! When I was younger, so much younger than today, I never needed anybody's help in any way. Now these days are gone.
Yeah, so I'm Dr. Kyle Contini. I'm a family medicine board certified. I've been in rural practice here in the Florida Panhandle for more than 10 years. It's naturally a struggle in this part of the state. Anyways, resources are scant and far apart. And you're talking about some of the poorer patients in the state up here, and so there's long distances involved no matter what is going on. Our practice, which is independent of any hospital system or government entity or agency, has always focused on having access to care. That's one of our biggest sticks. We want to have the patients have the option to be seen when they need us, and our entire mission has been grounded in that philosophy since the beginning.
So on today's episode, we're going to be talking about access to health care. There's two things I think most Americans and most Floridians would agree upon, that wherever you live in the state of Florida, number one, you'd like to have a doctor available to see you. And number two, heaven forbid, if you were to have something catastrophic happen, you'd like to have a nearby hospital. Unfortunately, for a lot of Floridians, these things are becoming pipe dreams. They're becoming ways of the past. And we are going to talk today about what needs to happen in the state of Florida to help reverse this. I want to introduce my two guests today on the podcast. First, let's start with Scott Darius. Scott is the Executive Director for Florida Voices for Health, and Holly Bullard, who is the Chief Strategy and Development Officer for the Florida Policy Institute. Holly, Scott, welcome to the podcast.
Hey, thanks for having us.
So, Scott, let's start with you. We just watched this disturbing video from a town called Stark, Florida. I think most Floridians are familiar with Stark. I mean, if you drive on I-10, if you've ever been to the Jacksonville area, you've probably driven right by the exit. There's also a similar problem going on in Live Oak for people that live in the Panhandle and travel to Disney, travel to Tampa. Most panhandlers probably stop at Live Oak. They probably stop at the Busy Bee right there in Live Oak, which is very busy. And to think that towns of this magnitude, towns of this size, could possibly be going without health care. I mean, what are we to make of this?
I'd actually throw in Lake City too, right? Another major kind of like rural community that's lost a hospital recently. And in North Central Florida, right? Like I think there are rural communities throughout the state. But my mind always goes to North Central Florida and into the Panhandle. But in that area, we've lost 3 rural hospitals since March of 2020. And if you think back, I know it was a long time ago, but that was a really specific time in history. So to lose 3 rural hospitals at that moment, it wasn't just emergency care, right, that people relied on these hospitals for. It was also primary care. So about 70% of the people who live in and around Stark and Lake City in these areas lost their actual provider, primary care provider, or the place where they got that kind of care. And yeah, all the kind of negative consequences that flow from people not being able to access a doctor in an emergency, but also for the preventative things. I think we're starting to see the outcomes play out for Floridians, but rural Floridians especially.
And Holly, what exactly are we seeing there? Because this isn't an isolated event, right? I mean, this is happening across the state.
Yeah, and there are other hospitals for sure in rural areas that would be sort of on the chopping block, if you will, and worried about basically their financial sustainability. And that it really impacts all of us in the state of Florida about the coverage of folks. And basically, what we're seeing is an increase in the uninsured rate from federal policy, from policies over time in Florida. And so, um, you know, we don't often think about the fact that our neighbors' health coverage does impact us directly, both in the cost of our own health coverage, and then to your point about the availability and access to healthcare, and that has to do with hospital and healthcare financing and how it's paid for in Florida and across the nation. But this is not isolated even to Florida in terms of rural health access.
And Scott, we can look at it one of two ways, right? I mean, as a doctor, my first thought is, where are the doctors in these areas? Is it affecting recruiting doctors? And then, of course, there's the hospital angle. And we'll talk about both angles on this podcast. First and foremost, the physicians themselves, Scott, how difficult is it getting uh, to recruit a physician to these areas?
I think Holly made a great point that underlies this entire conversation, which is the financial proposition, right? The way our healthcare system is built, financially, it's not sustainable to provide care in rural areas, whether you're looking at it from the perspective of a hospital or individual providers. As part of our work as Florida Voices for Health, it's really about connecting with people in communities and hearing their stories for themselves and hopefully giving them a chance to share it. And it reminds me that, a couple of years ago, we spoke to a provider who used to be in the Lake City area, I believe, someone who had just moved down, moved into the state with kind of the influx of population that we had. And while he settled, what he quickly realized was the high number of people who were uninsured, meaning, if he sees those folks, he's not getting reimbursed for that care whatsoever. You also have communities that are obviously much smaller. And so to make the kind of revenue that you would need to sustain, you basically have to see everyone there locally. And then, for the folks who are enrolled in programs like Medicaid, the reimbursement for those things for care provided through Medicaid is so low as it stands that it's just really, you're losing money really on every patient that you see. And so financially, it's just not a great proposition for physicians who, as they step into, especially young ones, as we try to recruit new providers, if you have folks who are still dealing with a high level of student debt, yeah, rural communities, maybe even if your heart is there, even if it's a place where you want to serve, it just doesn't make sense to do that sometimes while you still have to pay down your student loans and other things like that. So I think recruitment has been, yeah, really difficult in rural places.
Well, and Holly, what do you think about that? Because, I'm from a small town. I'm from a small town in Mississippi, a population of under 10,000 people. Back when I was growing up, every town along the interstate had their own hospital. And it was almost like a competition, right? Ours is better than yours, et cetera, et cetera. And these are mostly county owned or city owned hospitals, city run hospitals. What has
Mhm.
changed? Because back when I was a young boy, all of these hospitals were profitable. You've never imagined Brookhaven, Mississippi would be without a hospital. And certainly here in the state of Florida, you can't fathom that a place like Live Oak, where you're stopping for gas and they have a Wendy's, they have a Taco Bell, they have everything you want in life except a hospital. How did we go from being profitable to all of a sudden they can't keep their doors open?
Well, definitely, it's not just one thing. It's really hard to, and we could go on and on about all of the different policy changes over several decades, both sort of private and whether that's insurance coverage. So with the private policies and private policy change over time as well of just like what is profitable, whether that's consolidation of different providers. Some people could point at things like private equity or on the actual provider side. And then there's the government side of making decisions over time. And just, honestly, with our decision in Florida and honestly Mississippi, who's Speaker of the House, by the way, is very supportive of a concept of getting them to a point of Medicaid expansion because of this reason. Because it's like it's not a salve, it's not 100% going to fix what you're talking about, but it is one piece of a puzzle of how do you address this tremendous gap. Yeah, like if you stop in Live Oak and you have a heart attack, or for God forbid, our neighbors who live in our rural areas and need emergency assistance, it's just a crisis that is a little bit more unseen. And unfortunately for our rural neighbors and communities, you're sort of the tip of the iceberg, if you will, in terms of healthcare crisis, just because it's going to come home to roost there the quickest. But that does not mean at all that if this is not going to impact the rest of our state. And honestly, where we're seeing over this next couple years, where we have the Congressional Budget Office projecting numbers of our uninsured rate in Florida growing even more, which is sort of unfathomable to me because we're already we stick around the fourth highest uninsured rate in the nation, which is pretty incredible considering we're the third largest state. And so that's just dollars and cents when you're talking about providers and money for healthcare providers and how they're paid. And then also like what the insurance costs are for each individual. The Florida Chamber of Commerce actually calls it the uninsured tax, right? Like this is not a partisan issue, or it hasn't been in the past in terms of how we address this. And yeah, because especially our rural communities are those first folks, this canary in the coal mine of our healthcare crisis.
Let me give my perspective as a physician in the state of Florida, because as you talk about, keeping your doors open and how did we get here? When I first opened my solo practice as a family doctor in rural Navarre, so I'm in Santa Rosa County, which is a very rural county. Um,
Mm.
I initially took all comers, right? I initially took all forms of insurance. I took all government insurances. And specifically, when you talk about Medicaid as it is run in the state of Florida. So Holly Scott, when I first opened, I wanted to be everybody's savior and I wanted to be everything to everyone. And so, eventually, when the bills come due, and you do have to pay your mortgage, you do have to pay your electric bill. Eventually, I had to make the tough decision to no longer accept Florida Medicaid. And why was that? Because the way Medicaid was run at the time, and I'm sure it hasn't gotten any better, but at the time, frankly, I got tired of waiting 90 days to get a check in the mail for $3 for, $500 worth of work.
The current Medicaid system in Florida is abysmal. Unfortunately, the HMO system that we have now takes money from the state, and in theory, they're organizing the patient's care. But unfortunately, like most of these kind of systems do, the private companies that have the contracts basically want to keep a hold of that money. And so there's very little incentive for them to provide actual care to the patients. The HMO system, unfortunately, breaks the state up into a whole bunch of small areas. And so if you're out of your area, you can still get care, but not usually with your coverage. I don't have any patients on Florida Medicaid right now who are happy, and they shouldn't be because they can't really get anything for their Medicaid services. I just isn't productive in general, because I think if we went back to fee for service and took these private companies out of it, there's at least a chance we could have a better system. One of the bigger problems for me personally is that the little HMO companies will do what they call clawback. So they'll say, "Hey, well, we know you saw that patient last year, and we've decided that we're going to pay you less than what we paid you before." The HMOs for Medicaid, for Florida Medicaid in particular, are the absolute worst for this.
For a lot of these physicians, um, sometimes the way things are run, it's just unsustainable to keep the doors open. Now, we're going to talk about Medicaid in detail because my personal experience 20 years ago, that does not have to be the law of the land. I mean, there are other states who, in my opinion, do a much better job of managing their state Medicaid program. And hopefully we'll talk in detail about that. But Scott, I wanted to go back to you because hearing my struggles as a physician, and trying to accept all these insurances, and it's not just Medicaid. Let's be very clear about that.
Yeah.
That is one example of something that we, as people who are crafting policies, that's one example that we can actually fix. That's one example where we can actually come forward with solutions. But Scott, I was having similar problems with Blue Cross of Florida. I was having similar problems with Aetna, with Cigna. I mean, when you look at what my reimbursement rate was back in 2005, and after 20 years of inflation, cost of living increases, when you see that my reimbursement really has not changed in 20 years, everybody else is gaining ground with inflation. Doctors are losing ground. And so I didn't know if you had a comment on that.
No, I think one point I'd start with, right, to kind of echo what's been shared already, is that there really isn't one solution that's going to fix the healthcare system at this point. And anyone who's telling you that they have the one thing that's going to fix all the problems is probably is lying to you ultimately. And but that doesn't mean that there aren't like these singular opportunities to actually take a chunk out of what the problem is, right, or to address some low hanging fruit. Medicaid expansion is a way to get more people covered is one of those solutions. I think as we think about providers and, the story that you shared and such a common experience, as part of our work, again, as voices, is bringing those people who we meet in community up to Tallahassee to meet with legislators. And for the last few years, we've been bringing up dental providers or just other people who accept Medicaid, who currently are accepting Medicaid. And they talk about the administrative burdens that are in the program, right? And how hard it is. You have a heart to serve this community, to serve low income Floridians, but how difficult it is as a provider to do that because of how low the reimbursements are, and then all the hoops you have to jump through to get that low reimbursement. Basically, exactly what you just laid out. And so it's another major part of this problem that exists in our healthcare system, right? It's not just about getting people in coverage, but once they are, how are we making the system around them work better? Yeah, and part of that is, taking better care of providers and just making the system a little bit easier to navigate.
So, Scott, one thing we used to do back in Mississippi, if you're someone who wants to go to medical school, they have scholarship programs in Mississippi where all you have to do is say, look, if you'll pay for my learning, I will agree to go back to the Mississippi Delta. I will agree to go back to these horribly underserved communities that do exist in Mississippi. Places that their healthcare resembles the healthcare of a third world country, and it's a shame. It's tragic. And so Mississippi realized they had a problem. They realized that it was hard to attract doctors to these rural communities. And so what did they do? They paid for scholarships. They paid for these doctors to be trained. And all you had to do was promise to go serve in these communities for 1 year, 2 years, 3 years. Um, when I was in the legislature, Scott, I heard that we have, I guess, a similar program in Florida. It's just that the program exists, but there's no funding. I mean, was there any truth to that rumor?
Yeah, no, we've had that. It's one of those programs, right, where basically after you've gone through school, you can get loan forgiveness. There you go. It's a loan forgiveness program. So kind of after the fact, you can have, your loans forgiven or paid substantially if you go back to serve in those underserved communities. I think the difficulty with it is one, it hasn't been funded consistently over time. I think sporadically there's been some funding in there, and Live Healthy that passed a couple of years ago was supposed to add some additional funding to it. But yeah, I think every year we're kind of just like waiting to see how it plays out. Uh, but I think even in the scenario where it is, it's I think its impact is limited by problems in the underlying system, right? Because it means that I guess you have to have access points, right? Like if somebody wants to go back to serve in those communities, they have to have a place to serve, which means there has to be a hospital open or there have to be other kind of like, yeah, places where primary care or other services are being provided. But because, you have so many access points closing, there are even fewer places to serve, even if you wanted to go back. And then there's the thought of like, hey, well, I can go by myself individually and go, right, set up a practice and do that work. But if the overall system isn't making it financially viable, right? Like as a thing to do, then you're just going back into debt anyway. Whatever you gain from the loan forgiveness, you're losing every time you see Medicaid patients or take care of the uninsured. And so it's, again, as a solution, it feels good, but I think it's hampered by problems in the underlying system.
Well, Holly, the question I have for you, and Scott, feel free to jump in. I mean, we definitely want this to be kind of a roundtable. But Holly, as someone who used to be in the legislature and now I'm on the outside looking in, I guess one of my big disappointments is the fact that the legislature, you know, God bless them, they're really good at recognizing a problem, right? So every legislator understands that there is a problem with healthcare access. But again, God bless them. Sometimes the solutions don't match up properly with the problems. For one, I was very disappointed to see a ton of bills come through my healthcare committees where the goal seemed to be to promote healthcare access, but the rule of unintended consequences, you wonder, well, is this really going to help access at all? And I'll give you an example, Holly. We had a lot of bills that had to do with um, expanding people's responsibilities and people's roles in the healthcare system in Florida. For example, we had legislation that was trying to improve psychiatric care in certain areas. So they were creating psychiatric care nurse practitioners that could practice autonomously. There were all these bills pertaining to autonomous practice when it comes to nurse practitioners in the state. We even had bills in those similar veins for veterinary care, for dental care, even. And Holly, I guess my big disappointment, my big concern is that you were expanding roles of non-physicians in the state of Florida, but on each and every bill, when I would ask the bill sponsors, well, what's the goal here? They would say, well, we want to improve access to care in rural communities. I would say, show me the line in the bill that says that these new providers must practice in Port St. Joe. Show me where it says in the statute that they must practice in Stark, Florida. And of course, the answer was there were no such requirements. There were no such regulations. I don't think we have a numbers problem. I think we have an access problem. If all you do is create more numbers and say, hey, all of a sudden we've got more doctors, guess where most of them are going to go? They're going to go where their practices can be more viable. I mean, if you go to Destin, Florida right now, the three of us can talk about how there is a problem with access to care, particularly in the mental health sector. But if you go to
Mhm.
Destin, Florida right now, Holly, you can't throw a rock without hitting a psychiatrist. The problem is they only accept cash.
Florida spends a ton of our general revenue on our mental health funding from directly. And as former legislator, I know that you very familiar with this, and that we're actually spending a lot, just 100% out of our dollars that are from our tax dollars from Florida, from Floridians, that we could actually be tapping into more federal dollars, and other states are, right? And so that's a key area of our state budget where we're kind of wasting money. I hate to say it like that, but for lack of a better words, we because we are spending 100% for a lot of these mental health programs, where if we were to expand Medicaid, because of the way that it's set up, we're supposed to be drawing down federal dollars, and states like California and New York and others, even other red states, are doing this, and are getting covered for stuff that we're paying 100% out of pocket from our Florida taxpayers. And so we're just not fully utilizing everything at our disposal if you're not looking to Medicaid expansion. And the mental health commission that the legislature put together. I'm not sure if you're familiar with their findings, right? The legislature said we need a mental health um, commission. That they met several times. They had sheriffs and providers, and it was a statewide commission. And in their findings, they said, well, we think we need to have this conversation because we would be saving a ton of money, and we would be helping to at least cover, again, not a panacea, right? This is not a solution for everything, but it was one of their core solutions. And that was a legislative um, put together commission and committee that met a couple years ago. And that was a key finding was, hey, what does Medicaid expansion look like, especially for some of these younger populations who just aged out of care or coverage from their parents, and are uninsured, and they have severe mental health issues. We're paying for those folks 100% out of our state dollars. And so just on the dollars and cents for our state budget, it makes sense to look at that as well in terms of the coverage rates that Medicaid expansion would offer for certain populations.
Well, and Scott, I'll give you the final word when it comes to these relationships with providers. Like I said earlier, we would have no shortage of scope of practice bills when I was in the legislature. So the legislators, they wanted to improve access for care, and a lot of these bills I voted down. I voted against these. When you expand someone's scope of practice, when someone doesn't practice autonomously and now you want to give them those responsibilities. I actually voted against practically all of those bills because, again, in my judgment, all these bills were going to do, they were going to create more cash only clinics in Destin. They were going to create more IV drip services for the wealthy. There was nothing in this legislation that would address rural communities. My sense is, we're very close to a potential gain here. We're very close to a potential solution, but for my purposes, I would like to tie loan forgiveness, or I would like to tie in. Look, if we're going to increase your scope of practice, if we're going to let you actually pull teeth, as a dental therapist, if we're going to let you actually see patients independently as a nurse practitioner, I would like there to be some requirement that in exchange for us granting you this, you agreed to serve in Sock Choppy for 1 year. You agreed to serve in Florida for 2 years.
What I will say is if you buy into that idea that it is an incomplete solution, right? So everything you just said about how do we tie that to more meaningful change that will actually solve the problem. I think what is true about scope of practice, whether or not you buy into it, is that it alone won't solve the problem of access, and actually alone doesn't solve the problem of access at all, right? You still have to have incentives for, the supervisor or whoever is like making the decision about where to be. They have to actively choose to be in rural areas. And yeah, without either more incentive or a specific directive to do that, I think what we've seen in the healthcare system is given a choice, people won't do it. And so, yeah, without those more specific kind of anchors, I don't think it will happen. Yeah, and maybe it just goes to the larger point of needing comprehensive solutions. And so, what will it take to do more than just little bits and pieces here and there? And I think that's a question of political courage, right? Like just being willing to put together a comprehensive solution, knowing that it's going to rock all the boats.
And that's actually a good point that you brought up, because if the problem is, let's say, Port St. Joe, if the problem is that you can't recruit physicians, and then you say, well, we'll bring in nurse practitioners. Well, if you can't recruit physicians and you can't recruit nurse practitioners, again, maybe that's shining a light on where the problem actually lies, that it's not profitable for anyone. And then, of course, like you say, you have to look in the mirror and ask yourself some hard questions that the politicians really, really struggle at doing. So now that we've talked about the providers, Holly, let's talk about the elephant in the room, because I'm going to cut here to a clip that I unearthed from August of 2023. I was a guest on a TV show down in Fort Lauderdale called This Week in South Florida, and I'm just going to play a clip for a few seconds.
Florida, about 1 million people just lost Medicaid coverage recently. There is no Medicaid expansion. So that hurdle is the hurdle, the elephant in the room, right? We know that Florida is one of 10 states left to expand Medicaid that's failed to expand Medicaid. 69% of Florida's children are on a Medicaid type program. But that's something that needs to happen. Not only do we need to expand it, but we need to raise the rates for Medicaid reimbursement. They haven't been raised since 1990s.
Exactly. And if I could piggyback on that,
Sure.
so she's absolutely right. I mean, something's got to give here. We call it a healthcare crisis. Well, when you're in the middle of a crisis, all options have to be on the table. We're one of the last remaining 10 states that have yet to expand Medicaid. This option needs to be put on the table.
So, Holly, that clip you just watched, that's been somewhat infamous, among Republican circles in the state of Florida, because here on a regional television live broadcast, as far as I know, I was the first Republican legislator, at least in this era, to say, hey, look, we really need to consider expanding Medicaid. What are we not doing that 43 other states have agreed to do? And Holly, for those who want to make this a political argument, are you telling me that 43 states out of 50 are blue? I mean, I don't think so. I mean,
Right.
if my statistics are correct, the most recent state to expand Medicaid was actually the Republican state of North Carolina, and in my last year in office in 2024, I actually invited one of the chief members of the North Carolina Senate down to Tallahassee to speak to our fellow Republicans, right? He's a Republican from extreme Western North Carolina, but he led the charge to expand Medicaid in the state of North Carolina. And Holly, why is that? Because his day job is he deals in insurance. He understands what's going on in healthcare,
Mm-hmm.
not just in North Carolina, but across the nation. And so Senator Kevin Corbin flew down to Tallahassee at my request, met with several Republicans in the state of Florida. But here on this broadcast that you just watched, you had at the time then Democratic Representative Hillary Cassell really kind of fly the flag, for Medicaid expansion. You had me agree with her. What progress has been made, Holly, in the Florida legislature since 2023?
Yeah, unfortunately, I don't know if we've gone in the right direction in the legislature. And to be honest, I think that that's, a sign of the times of a federal kind of shift on approach to Medicaid, right? Of just looking at even some of our advocates and how we've had to address Medicaid more of protecting protecting the current system in addition to saying, hey, how can we improve it? It feels like it's shifted over the last couple of years. Unfortunately, I think um, what we will see right now, the state is, we're projecting a deficit in 2028. We're going to see impacts of our health of federal health policy changes from last year but honestly just sort of also accumulate over decades as you said, like in rural communities, and then sort of some of these decisions, including honestly like HR1 had this rural sort of pot of money to support rural healthcare, but then in the end CMS didn't allow them to use it for like hospital finance. So it's actually not going to help directly. It's going to have to be something different. And so we're at a very critical point in Florida, and our uninsured rate is projected to increase to a point that it hasn't been even since before 2014. And even if if you're not directly impacted by this, if in terms of your healthcare, losing your healthcare, losing your health insurance, we all are impacted again. And so it's going to kind of come to more of a head than ever because of constituents, right? This is not partisan. These are people saying, I've lost my health care, or our providers are leaving, or just things are pressure is building. And on top of just affordability around things like housing and food and gas, and crowding out that decision to say, well, my premium skyrocketed. Am I really going to be able to afford that on top of these other, really real issues? That is not partisan at all. That has not to do with party. And so I'm hoping that across the state of Florida, like leaning on all of our representatives and senators and to say like this is a very real issue, and that actually having coverage, like having this come at from all sides of the solution, where something like Medicaid expansion is one part of it, because we have this critical mass of Floridians who they're too poor to qualify for the marketplace. This is true. Most people don't realize this. Scott and I talk about this a lot, and a lot of our partners in the health space around just how low and how poor you'd have to be in Florida to qualify for Medicaid. Right now, people don't realize this at all. Even people who are well-meaning, even providers sometimes. This is why I think Dr. Redmond, you came out in support of it as well, around saying, well, if you are even right now, if you are a let's say you're a single mom with 1 or 2 kids. If you have 2 kids and you make more than $8,000 a year, so let's say you're trying to get back up on your feet from something and you're trying to earn more money, you're actually going to be pushed off of Medicaid. So it's a disincentive to why would you do that? Why would you work in yourself into the coverage gap and put yourself at risk when you need to take care of your children? It is profoundly. I get goosebumps just thinking about how this terrible Faucian bargain that we're asking our parents to do in Florida. Unfortunately, I don't see it this past session. It was more about honestly adding more barriers to people currently on Medicaid, and that just kind of unearthed this fact where you go, well, actually, a lot of the legislators didn't understand the current system that we have, which is that if you are an adult and you don't have any dependents and you don't have disability, it doesn't matter how poor you are in Florida, you don't get Medicaid. Now, you are uninsured and you're contributing to costs for all of us because you're going to the ER for your doctor. Like the ER, whatever is in reach is 90 minutes away. That's where folks are going. If you're uninsured, you're going to get primary care from the ER. It's costing every taxpayer. It's adding to, having a busy ER and not being able to have an actual efficient system. So
We did see bills having to do with Medicaid work requirements this last session. And again, it just underlines the fact that legislators don't know how Florida Medicaid works. Now, don't misunderstand me. I'm thoroughly in favor of having some sort of work requirement or something to get government benefits. I'm not opposed to the idea. But what Holly is saying, ladies and gentlemen, is the only way you're currently going to get Florida Medicaid is if you're permanently disabled. So how are you going to work if you're permanently disabled? Or number two, you have to be a mother of small children. So if there's a work requirement, what happens to the kids? Who's looking after the kids? So again,
yeah,
it showed basically a lack of understanding with how the current system is run. And again, to be clear, Medicaid is a state-run program. So the rules in Florida are not the same rules as in Mississippi, for example, as in Louisiana. So it's entirely possible, ladies and gentlemen, that you could move here from Mississippi. You may have a situation that qualifies you for Medicaid in Mississippi, and then you move to Florida, and that same situation leaves you on the outside looking in, and you do not qualify in Florida. So again, Holly, it's like they were proposing bills that maybe would be right in a Mississippi or in a North Carolina or in a Louisiana, but they've
yeah,
already got the requirements so strict in Florida that the bills really made no sense. And Scott,
absolutely.
I wanted to turn to you, Scott. I know I've left you out here for a couple minutes. I wanted to ask you, I want to connect the dots for the viewers because they're probably like, how did this morph into a Medicaid discussion? Well, when we talk about rural health care, Scott, I came prepared with numbers. You know, when I was a state representative, I represented the tiny community of Jay, Florida, which has their own hospital. Jay is a farming community up on the Alabama border. It's about a 45-minute drive to the nearest hospital if it weren't for the community hospital in Jay. So the community hospital there operates, Scott, at a loss. I don't think I'm sharing any confidential information by saying that. And why does that happen? Because, like Holly mentioned earlier, when you get in these rural communities, the payer mix is not the same as a payer mix in a Boca
Oh,
Raton, in a Destin. You're talking about people who, if you're lucky, they have Medicaid. If you're lucky, you're getting $5, $10. If you're unlucky, they are uninsured. They have nothing at all, in which case you're giving out emergency room care, hospital care for free. Um, Over in nearby Walton County, there's a group of people just reopened the community hospital there in Defuniak Springs, North Walton Doctors Hospital. I got their numbers, Scott, the other night. They told me that in their ER, their hospital, the whole shebang, 20% of the patient population they see is Medicaid. 20% is uninsured. In other words, 20% of the care they give out is basically going to be free.
One of my other hats is to work in the ER here in Bonifay, Florida. Real small ER. The population here, of course, talking about the Medicaid folks again, they are long or overwhelmingly driven to the ER because of the way the system is set up. Their access to primary care is not good. Their access to specialty care is abysmal most of the time. And so they turn to the ER to try and get something done. That's not necessarily the right thing to do. And medically, it doesn't necessarily work out. But I understand why they do it, because what are they going to do? They don't have any other choices. The uninsured population is pretty big tier two, and obviously those people go to the ER a lot as well. Current state of the Medicaid system leaves our poor little hospital, which, for better or worse, runs close to the red all the time. It's just the nature of rural hospitals in general.
So, Scott, let's connect the dots for the people who are trying to make sense out of all this. If you're running a hospital in Defuniak Springs, or if you're running a hospital in Jay, Florida, and a sizable chunk of your patient population is Medicaid, certainly you're going to want that as a hospital funded to the gills. Certainly you're going to want to get more than $5 per patient, and in other states, Scott, they do that. In Louisiana, for example, Medicaid rates are comparable to Medicare rates. And, I've never met a hospital administrator who has anything bad to say about Medicare. So, Scott, if we can at least fund Medicaid the way it should be funded, and then second of all, we talk about this huge uninsured population, 20% or more. A lot of those uninsured, Scott, they are what you and I would refer to as the working poor, right? They're that waitress at the local restaurant. They're the person who works part-time at Walmart. And Holly, because they work part-time, they're not eligible for health care benefits. These are people, Scott, who, if they were in the state of Louisiana, these are people who would qualify for Medicaid. And again, if we were in the state of Louisiana, these would be hospitals and providers that would be glad to see them. Are you telling me that Louisiana can do something better than the state of Florida? I think not. What can we learn from Louisiana?
Listen, the Gator fan in me is not going to let that slide. Okay. So I'll work my way through it emotionally. But yeah, just to connect the dots, right? Like we're talking about rural communities in Florida, which mean it's a smaller population than you would have in Miami-Dade, right? So already just the base number of people you're dealing with is a smaller number, meaning you have to really max out the number of people that you're seeing and the reimbursements that you're getting from them to make any kind of provision of care sustainable. Now, we know that in rural communities, there's already a much higher uninsured rate than there are in more urban areas. In Florida, I think it's something like 18.8%, closer to 20% of rural Floridians who are uninsured versus about 12, 13% in other parts of the state. So you already, in this like smaller bucket of people, you have a larger chunk of them that are uninsured. Now, like you mentioned, the payer mix of the hospital you talked about up in the Panhandle, where there's a large population of folks who are on Medicaid, right? And we know that the reimbursement rate for Medicaid, it's about 65% of what Medicare pays, which, yeah, isn't great if you're a provider who's seeing these folks. But the only thing that's worse than like a Medicaid reimbursement is no reimbursement. And so
Exactly.
exactly, right? And so when you have this huge number of uninsured people, the one
Yeah.
thing we can be doing to help hospitals be sustainable over time is getting more people in coverage. Even if it's at the currently really low Medicaid reimbursement rate, you're helping hospitals to be in a much stronger position. One of the things we've seen Holly talked about Medicaid expansion. You talked about it being in 40 other states already. And I think the only good thing to come from Florida being left out is that we've watched this experiment play out in 40 other states at this point. And so how we talk about it, it's less theoretical and more based on the very specific outcomes we've seen in the red and blue states and purple states that have done it. Now, in those expansion states, their rural hospitals, first of all rural hospitals everywhere are doing the best they can with the little bit that they have. But those in Medicaid expansion states find themselves operating with like a 1.2% margin, right? Like operating margin in profit. So it's tiny, but it's there, just enough to sustain and make a little bit more. But in non-expansion states, the margins, operating margins for rural hospitals, it's minus 0.7%. And so just kind of on the face of it, you see how, how crucial having more coverage is to the long-term sustainability of these hospitals.
Well, and Holly, to me, it's a no-brainer, right? Because as Scott basically referenced, if you're a doctor, if you're a hospital, if you're a physical therapy office, would you rather be paid nothing or would you rather be paid $10? I mean, I know it's not a lot, but
Yeah.
certainly some remuneration is better than none, correct? And then Holly, let's also just blow apart this myth that somehow you're not a conservative if you want to help the working poor, because that's who we're talking about, Holly. As you expertly laid out earlier, the dirt poor, they're already covered. If you're a hardcore right winger and your problem is with baby mamas, guess what? You're already helping the baby mamas. What we are talking about, Holly, we're talking about getting people out of the trap of poverty. Someone who wants to work at the Tom Thumb gas station, but I also have to work a second job as a waitress at the Johnny Houston's restaurant. You are basically consigning those hardworking Americans. You're basically telling them that health insurance is always going to be a pipe dream to you. And so again, let's dispel that myth that this is about red or blue. Let's dispel the myth that this is about Democrat or Republican. We're talking about your neighbors. We're talking about your waitress. We're talking about your, the person who cleans the hotel rooms. We're talking about those hardworking Floridians who don't have $20,000 in the bank to go spend yearly on health insurance. And the other myth, Holly, again, I want you to chime in on this. The other myth that I want to go blow up right here and right now is the fact that your taxes are not going to go up to benefit the waitress, the bartender, the construction worker, right? The ditch digger. Because guess what? Your Medicaid payments that you're paying into, that's your income taxes. You've already written that check to the IRS back in April. What's happening, Holly, is that money that Floridians are paying to the Internal Revenue Service, money that should come back to the state of Florida in the form of Medicaid expansion. Holly, we're talking about billions of dollars, billions with a B. That money is basically being sent to other states. Why? Because our politicians in the state of Florida, after you pay your check to the IRS and after you're waiting for that money to come back and benefit your neighbors, your politicians in the state of Florida have told the federal government, no, that's okay. Why don't you give more money to California? Why don't you give more money to Oregon? Holly, I don't know about you. I would like to turn the tables. I would like to tell the federal government, yes, please, we would like some of our money returned to the state. We would like other states' money. We would like California's money. We would like some of Oregon's money to be spent on the poor and the working poor here in the state of Florida. Now,
Yeah.
where am I wrong?
Uh, the only thing it would be, I would add other parts. And I think you said it well in an op-eds last fall around some updates at the federal level, right? So Scott and I and many others for a decade or so have talked to legislators, both parties, but behind the scenes, people who are willing to talk through this and to say, okay, well, but what about all of these questions that you have brought up, and to kind of walk through that. And one of the key pushbacks I've received is about this idea of work reporting requirements, and there are, we have concerns around how it would be implemented and what sort of like the outcomes are and what the goals are. But regardless, in HR1, which was the One Big Beautiful Bill Act in July, it included so that if we were to expand Medicaid, and I hope we do on the ballot, and Florida Decides Healthcare is trying to do that, and to get folks to sign our petitions. But if we were to do that, anyone who expands Medicaid from now on, you're joining the rest of the nation in creating these work reporting requirements for the expansion folks, right? So And that makes sense because, to your point, if you're a waitress and you're trying to not work yourself into the coverage gap, like you are working, right? It's not like people who are needing healthcare in that space and you're a parent that you're not working. HR1 added some of these components to it that I just don't understand the holdup anymore, even from folks who say, hey, we want all of these extra eligibility checks. We want all of these things. And, from what I hear from Dr. Oz, he's fixed Medicaid. So, I don't understand what the holdup is at this moment now that this big bill has passed, and to say, well, in for expansion states, they have these programs that are just there, right? That they would be part of the story moving forward. And the fact that we haven't reapproached it since that to say if that was your holdup, it's gone, right? That excuse is no longer there.
Just so people at home understand, Medicaid expansion would bring more federal dollars to the state. It doesn't raise your taxes 1 cent. It brings some of the money you've already paid to the government back to your state to help your neighbors. As we said earlier, Scott, to me, it's just embarrassing, not just as a former legislator, but also as a Florida citizen. It's embarrassing to hear that there is a Republican state in the deep South, Louisiana, that not only fully funds Medicaid, not only did they expand Medicaid as we're talking about doing, not only did they have the political courage to do that, but now as a result, they're able to fully fund Medicaid to the degree where the reimbursement for their physicians is adequate. So, I want to give each one
Yeah.
of you a few minutes here in closing to have the last word. So Scott, I'll let you wrap up first.
Yeah, the first thing I'll say is that it makes sense, right? When you look at the way it's played out in other states, across all the reasons that we've talked about here today, it just makes sense for Florida. I think it's telling that, all the other states that have expanded, including red states, haven't, because they all have the opportunity to end the program if they decide it's not working for them. I think it's telling that none of them have walked away
Yeah.
from it. Uh, you know, I, I live in this space where I do think it's worth looking for opportunities to compromise. It's worth looking for ways to incorporate everyone's perspective into how these systems should be built out. And I'll say that there's a value in public trust, that people want to make sure that programs like Medicaid are serving the people that they're meant to serve and doing the things that they're supposed to do. And so I don't immediately bristle when someone says, "Hey, let's try to make sure that the people in the Medicaid program are working." I think it's just in our framing and how we think of it that really can lend to, having a more constructive conversation and ultimately a program that works better. For those people who, are thinking about this selfishly, right? Like, hey, you don't really care. Hey, what happens to the people in your community? I think that's actually a totally fine way to be too, right? If you live your life like that, that's okay. I think we're all human beings. We all have our autonomy. You can live your life like that if you choose. Even in that scenario where you want to live absolutely selfishly, Medicaid expansion is the best thing for you, right? You're not paying for people, you're not paying through your taxes for more people showing up in the ER, which is the most expensive place for care. Like Holly mentioned, in expansion states, we know that the what it costs for private healthcare coverage goes down 7 to 10%. And so, even through the most selfish lens, Medicaid
Mhm.
expansion is a thing that's best for you individually. And so, yeah, for all those reasons, I think it's time we just sit down and have a conversation because everybody is suffering in this way. And yeah, for those, if it doesn't happen through the legislature, I'm glad Florida's still a state where people can take it into their own hands and work on this ballot initiative with us.
Holly, you need last words to the viewers out there?
Yeah, my last words would be, if this resonates to you, please, you could actually go to medicaidflorida.org. We made it really easy. Request a petition. We're going to mail it to you with an envelope with a stamp on it, and then you can have a petition. You can have a petition for your neighbors or voter or whomever, and return that. And we will. We're looking to make 2028 again. This is red states, blue states. None of them have undone Medicaid expansion, and a state like Louisiana. Um, and eventually, more and more people saying this is the right thing to do, regardless of, how you look at it. It makes sense for Florida, for our communities.
Well, and for my part, I'm going to steal part of my closing argument from my good friend Senator Kevin Corbin over in North Carolina. when Senator Corbin visited the legislators in Tallahassee at my request, he had a great argument that I don't think you can come back at. We currently opt out of Medicaid expansion. We say no, we don't want our tax money used for Medicaid expansion. Senator Corbin asked everyone, "Did you get your Medicaid refund check in the mail yet?" Because those checks are not coming, ladies and gentlemen. You pay for Medicaid whether you realize it or not. What's happening in the state of Florida is most, if not the bulk of your Medicaid dollars are going to New York, to California, to places where they accepted Medicaid expansion. So the argument is, if you're a person who's been very blessed in your life and you don't envision yourself ever needing Medicaid, or any of your children or grandchildren ever needing Medicaid, if you don't envision there's ever going to be a scenario where that's going to happen, you're paying for it anyway. Would you rather your money go help strangers in California, or would you rather your money stay right here at home and help your citizens in the free state of Florida? And second of all, if you are unfortunate, if you are down on your luck, if you've had bad things happen in your life where you're between jobs or you're trying to find a better job, or ladies and gentlemen, I'll do you one better. Let's say you have a disabled child. If you are so mad that you have to take your Medicaid child, your permanently disabled child, if you're mad that you have to drive 5 hours to find a pediatrician that's willing to see them, if you're mad that no local provider accepts Medicaid, there's a reason for that. Florida does an abysmal job in terms of paying reimbursement to providers. And wouldn't it be better if we took some of that Medicaid expansion money and actually paid our physicians what they're worth in the state of Florida? So Scott, Holly, I'll wrap up by saying that maybe I'm a little naive. I tend to be optimistic. Maybe that's why I'm not in Tallahassee anymore. But we have an incoming Speaker of the House, Representative Sam Garrison, who I'm very hopeful for. Sam is a very kind-hearted individual. Sam knows what it's like. So hopefully, we will have leaders here very soon in the state of Florida that have the political courage to come out, listen to the arguments that we've made. I know Sam personally. I have had this discussion with future Speaker Garrison. So I'm hopeful of good things in the near future. In the video that I showed earlier, you had Representative Cassell, who at the time was a Democrat. She has since switched parties to the Republican Party. If Rep. Cassell comes back, she's on the side of the aisle that will probably be in power. And so I would like to hear these people wave the flag again. It's really easy to be a proponent for Medicare expansion when there's nothing you can do about it. It's really easy to be the person on the outside looking in, flying the flag.
Yeah.
Well, now that some of these people are in positions of authority, now we need you to get the flag back out. Now we need you to get out there and use the podium and preach on behalf of those people you represent so ably in years before. So let's hope that leaders like Sam Garrison, Hillary Cassell, there's numerous other politicians, both Republican and Democrat. They know the right thing to do. Let's just pray and hope that in upcoming legislatures that they will find the courage to do what must be done. Holly, Scott, I've enjoyed talking to you guys today. Thank you for appearing on the podcast.
Requests of the Florida legislature would be to go back to fee-for-service Medicaid. What I see happening all the time is that these little HMO companies, like I said earlier, they deny care, they withhold care, they have no incentive to provide 100% of what they're supposed to do. And that affects everybody. So it affects the patients, obviously, they're not getting care that they need. It affects the providers because it discourages us from participating. It's such a broken system. And it's especially hard to get a specialist, and certainly in the Panhandle, there's hardly any specialists that take this Medicaid stuff here at all. The HMOs, I mean. If we could go back to fee for service, it would take away this fragmentation of the state. So another big example: when a patient visits from South Florida here, they get seen in the ER. The hospital does not get paid for that at all. It's very broken. It results in poor care. It results in no care at times. It results in a very fragmented system, and the access to care is just almost non-existent in some places.
Help me get my feet back